African Americans and why there is a higher percentage of African American deaths, whether it's Detroit, whether it's Mecklenburg County, North Carolina, whether it's Milwaukee, Wisconsin. The Surgeon General just said this morning, I and many Black Americans are at higher risk of COVID. Do we know why, and what are the initial numbers telling us?
Well, there's a host of reasons why that's the case. So one of it is socioeconomic. These are the folks who are having to leave the home to do their service jobs, their essential service jobs, things like working at the grocery checkout counter, driving our cars, and so on. So they're having to leave the home, and so they're more likely to be infected in the first place. But then once they're infected, they're also more likely to have severe disease. So these are populations that have higher risks of or higher likelihood of having high blood pressure, diabetes, being overweight. And on top of that, we're also seeing that people who live in counties where air pollution rates are worse are also at higher risk of severe COVID. So there's a number of factors driving this.
Interesting. I did not know about pollution. I want to ask you another question, Dr. Gowner. This has been a curiosity of mine, and I imagine maybe some of our viewers. So flattening the curve, as it is, right? Slowing the rate of growth in infections. That's really about not overwhelming hospitals. So you don't have a peak of this when the hospital